Hi, this is the lab prep for lab number 6, subcutaneous, intradermal, and intramuscular injections. First off, I'd like to start off with a definition of parenteral. And when I heard this, I was like, I wanted to always call it parental. Very different in definition. Parenteral is definition is something administered or occurring elsewhere in the body other than the mouth and the alimentary canal. So therefore, when you give medications, this does not include pills, rectal suppositories, and that sort of thing. It includes all injections and intravenous. So that is the word parenteral. All injections are parenteral medications. The Blackboard Prep is on your student handout. You have 5 videos to watch. There are several short clips as far as injection positioning and, of course, your readings. Equipment needed for injections are the medication order, correct size syringe. We'll spend a little time talking about that, alcohol swabs, and, of course, gloves. Parts of the syringe, just to go over these really quickly with you. You have the plunger, you get the barrel that could be plastic or glass, mostly plastic. You measure from here, and I'm sure you've done this with your dosage calc numerous times. This is the tip of the barrel, and you have a hub which can be color coded, and it may also have the gauge on it, the actual shaft of the needle, and the bevel. And you can see that these are basically 2 pieces. You always want to keep the shaft sterile. The tip of the needle may either be a luer lock or a luer slip. When you put the needle on, the luer slip is held on by pressure. The luer lock is you're actually screwed in. So just make sure if you use a luer lock that it is snugly, the needle is snug up within that luer lock. The gauge and the length of needle is important. This you're just going to have to learn by doing and trying to remember. Couple of things. The higher the gauge number, say 25 to 30 or something like that, the smaller the needle. Okay? The higher the gauge, the smaller the needle. The lower the number, say 18, the larger the needle, the larger the gauge. Okay? Length can be anything, but usually the shorter length is going to be for your sub-Qs, the longer length is going to be for your IMs. These are lovely colors, but you cannot base what gauge it is by the color of the hub. Different companies make different colors. So again, if you have one company where you're working, fine, but if not, you'll really have to look on the package to see what the gauge of the needle is. Different types of syringes are important, and you'll be choosing that based on the weight of the patient, the medication you're giving, the location, that sort of thing. This is a 1 milliliter syringe, and you can see this is a sub-Q, very short, fine needle. This is an IM. It's still not a very large gauge needle, but it's probably a 2 to 3 cc syringe. And then also you can get up to a 5 cc syringe or 5 milliliter syringe, for IM injections. I have a 10 milliliter syringe just to show you here, but you would never see a 10 cc or 10 milliliter syringe used for injections. It's just too much fluid. Safety syringes are designed to protect you. We'll be using a variety of these in the lab, and basically you're the operator and you need to make sure you engage these, and you'll be starting your practice with this, so I think that that's something that will be absolutely come natural for you. Preventing needle sticks. Make sure you do not recap contaminated needles. That is a cardinal rule here. Put your needle in a needle container. This one here happens to be full. Make sure that you don't use needle containers that are too full, because you could stick your finger in onto a needle. So this one I would certainly get rid of and get a new one. This is a great one for on a wall. You can actually see when it's too full, and in this one, instead of putting your finger, dropping it in, and believe me, you do drop these, you don't tuck them down in. This one here, you lay horizontally and then flip this up, so it drops in that way. It's much more safe to put in a used needle. And then as far as capping, if you do need to recap, say after you've loaded up or drawn up your medication, you use the one-handed scoop method. And here is one way to do it, and here's another way. You can actually put the cap here, and you can recap easily without contamination. If you do get a needle stick, and I hope you don't, really watch how you recap needles and engaging those safety devices. Please wash it out very quickly and report the incident to your instructor supervisor right away, and because there is a protocol that needs to be followed, and believe me, you do want to make sure that you report this. It's very important. Medications we're going to be drawing up are out of vials. We'll be using a vial in the lab. This is a multi-dose flu vaccine vial, or here's a single-dose vial. This could be for a PPD or a TB test. These are pre-filled syringes down here. And then, of course, you've got an ampule. We'll not be using those in the lab because we don't really use those much anymore in clinical. But we will be focusing on use of the vial. The angles for insertions, you have this in your book. I just wanted to make sure that you're aware of the intramuscular is 90. We must get down to the muscular layer. Subcutaneous can be either 90 or 45, and your intradermal is 15. I want you to familiarize yourself with the layers here that you need to be aware of, the intradermis, dermis, all the way down to the muscle. And you really need to understand what it is you're doing and where you're giving the medication. And your technique does make a difference. Intramuscular, I'm not going to spend a whole lot of time on this. Usually it's a 1 to 1.5 inch needle is standard. You must aspirate because you could be in a vessel in the muscle. So you may want to pull the skin taut or tight prior to the injections. The only exception to the aspiration are deltoid vaccinations, such as a flu shot or an anterolateral injection for infants. And this is researched by CDC in that they have found that there's no major vessels in these areas, so aspiration is not necessary. And as far as IMs are concerned, you need to familiarize yourself with these areas, how much you can give, how you can determine where these areas are on the body. We'll be practicing in the lab. And I like this ventral gluteal site here. It actually, you can see the schematic where the muscles and the superior iliac crest is, and how you put your hands to find the correct location for the ventral gluteal. This is the vastus lateralis. You need to know your trochanter, your lateral femoral condyle, and it's your middle third. It's a great muscle to give injections in, and relatively less painful than the anterior portion of the thigh. Intradermal injections, most of the time that you're going to be doing this is for a PPD or a TB test. It is done for allergy sensitivity, but those are usually done in offices. And you can see where this is done bevel up. You can only use 0.1 mil, a very small syringe and a small fine needle. And you want this in the dermis. And this is what they call a bleb, B-L-E-B, or a wheal, W-H-E-A-L. If you do not have this, that means that you do not have the medication intradermally, which means it may not react the way we want it to react. So we'll practice that in lab too, so no worries about that. Subcutaneous injections, basically up to a mil. You can do that, 0.5 to 1. And it's a fine needle gauge, 25 to 27. And here's your length. This is an example of a subcutaneous syringe where you can really get this right down to the tenths as far as drawing up your medication, which we will do in the lab. Insulin syringes are sub-Q, but you need to use insulin syringes for insulin. And I think that's, as far as the other syringes are concerned, you have some choices, but when it comes to insulin, you must use an insulin syringe because they are in units, not milliliters. So here we have a 30 unit, a 50 unit, and a 100 unit. Depending on what it is that you're drawing up and the number of units that you need, that will dictate what size syringe that you're using. Now, some places don't have all 3 sizes. They may have just 2 sizes. It's based on your facility, but you want to get the most accurate, correct amount. Use the correct size insulin. Don't ever substitute another syringe for insulin. That's another cardinal rule here. Locations of your subcutaneous injections. Insulins are really done well in the abdomen, thighs, and in the arms. And it's because we don't manipulate these areas that well. It absorbs at a particular rate. So you'll find that people that do take insulin take them in their own in a particular area in their body. You can give injections on the back. I don't see that used very much at all. It's mostly the arms, the abdomens, and the anterior thigh. Subcutaneous, when you're giving this one, you want to make sure that you pinch the area. So what you're doing is you're actually pouching up the subcutaneous layer, so you get your injection right in there. You want it above the muscle, and in this particular schematic, it's a great schematic, but make sure you wear gloves when you do it. And again, we will be practicing this in the lab. So we will be doing the multi-dose vials, we'll be practicing giving injections, and we'll also be charting on the MAR. So if you have any questions, please let me know. You can get to me by email, or I can see you in the lab. And thank you very much. This is it.